Creutzfeldt-Jakob Disease, CJD, is a rare, degenerative, invariably fatal brain disorder that affects about 1 in every 1 million people worldwide each year. Early symptoms include memory loss, behavioral changes, and visual disturbances, swiftly progressing to mental deterioration, involuntary movements, and weak limbs. As the disease advances, patients may experience blindness, weakness, and eventually fall into a coma. Currently, there is no cure or specific treatment for CJD. Medical interventions focus on relieving symptoms and making the individual as comfortable as possible. Risk factors include a family history of the disease, exposure to brain or nervous system tissue, and certain genetic mutations. Here's a closer look at the complex and challenging aspects of Creutzfeldt-Jakob disease. Symptoms and progression of Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease, CJD, is a rapidly progressive and fatal neurodegenerative condition. Symptoms often start with subtle psychiatric disturbances, such as depression, anxiety, and memory problems, before advancing to pronounced neurological issues. As CJD progresses, patients typically exhibit myoclonus, sudden, jerky movements, visual disturbances, and coordination problems, which may manifest as unsteady gait and difficulty walking. Cognitive impairment deepens, often leading to profound dementia. Additionally, patients may experience insomnia, speech difficulties, and changes in personality. The disease quickly intensifies, usually within months, leading to severe mental deterioration and ultimately to bedridden state, unresponsiveness, and coma. Due to the rapid course of CJD, life expectancy post-diagnosis is typically about a year. Diagnosis of Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease, CJD, a fatal neurodegenerative disorder caused by prions, presents with rapid deterioration of mental function and movement issues. Diagnosis is particularly challenging due to its resemblance to other forms of dementia. Brain MRI scans show characteristic high-signal abnormalities in the striatum and cortex, which critically assist in its identification. While definitive diagnosis often requires brain biopsy or post-mortem examination for prion proteins, less invasive tests like electroencephalography, EEG, can reveal typical periodic sharp-wave complexes. Cerebrospinal fluid (CSF) analysis for 14-3 proteins also aids in diagnosis, having been integrated into the WHO diagnostic criteria for CJD, signifying its clinical significance. Cause and risk factor of Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease, CJD, is a rare but devastating neurodegenerative disorder caused by abnormally folded proteins called prions. The exact mechanism triggering prion formation remains murky, but can involve genetic mutations, exposure to contaminated tissue, as with variant CJD linked to bovine spongiform encephalopathy, or may arise sporadically without any discernible cause. Certain genetic factors, such as a specific polymorphism in the PRNP gene, heighten susceptibility. Iatrogenic transmission, although rare now due to improved surgical procedures and blood product screening, historically posed a significant risk. Rapid neurological decline hallmarks the disease, emphasizing the urgency in understanding and preventing these risk factors. Treatment and management of Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease, CJD, a rare and deadly neurodegenerative condition, has no known cure or effective treatment to halt its progression. The management of CJD focuses on providing supportive care to alleviate symptoms and maintain quality of life. This includes administering medications such as clonazepam or valproate to control involuntary muscle jerks, and counseling to assist both patients and families cope with the emotional impact of the diagnosis. Since it's a prion disease, characterized by misfolded proteins causing brain damage, research is ongoing to understand the prion dynamics and find potential therapeutic targets. Early diagnosis is critical to offer palliative care and address neurological complications such as mobility loss, memory impairment, and behavioral changes. As clinicians and scientists tirelessly work towards understanding CJD better, hope lies in the advancement of medical research for future therapeutic interventions.